taxes can destroy your retirement plan if you don't plan for them.
That's right. We're Shannon and Michael. We are with Healthcare Genius, and today we're here to tell you about exactly how they can destroy your retirement and the things you should know so you can plan accordingly and protect yourself so you can enjoy all the things you've worked so hard for.
Yeah, Shannon, I mean, today we sit in probably some of the lowest tax rates that we've had in certainly recent history. And you hear a lot with the election going on about raising taxes. Most likely that's going to happen no matter who were to get elected. But what's really important is understanding how taxes impact you in retirement.
Yes.
There's a lot of people that have this misconception that when they retire, they're going to be in a lot lower tax bracket and therefore they're not going to have to worry about it. But one of the things that we always talk about when it comes to healthcare is that when you get to retirement, you no longer, for most people, get a deduction for your healthcare premiums and your healthcare costs. And by the way, Medicare is not free.
Medicare is far from free, particularly if you're a higher income earner, or really if you are, earn much more than your average American. So for a lot of people, there is kind of a double whammy here. You pay Medicare means testing, which means the more money you make, the more you pay for Medicare premiums, just the premiums. And then there is this tax piece that Michael was talking about. And a lot of people don't realize that when you're working, if you have employer paid health care, you do get those deductions. And it's something that a lot of us don't ever realize. And for many people, while you're working, healthcare is a lot cheaper than actually when you retire, which is totally backwards from what we're kind of taught to think.
And that whole tax piece, as you say, a lot of people just aren't aware of it when they're working about how that works. But essentially what happens is if you pay $1 for your share of healthcare premiums, you get to take that off the top of your taxes. So really, if you were in a 30% tax bracket, let's just use that, it's really only costing you 70 cents for your healthcare costs there. What's different about when you get to retirement is that you pay your Medicare premiums, they're not deductible. Again, there are certain circumstances where if people have really high medical expenses, they can deduct some of them. But for most people, they're not going to be deducting these expenses. So that dollar, you actually have to earn more money to be able to have a net dollar come out to pay for that. Good example of that is 401k or retirement plans. Most people are saving all of their retirement money into some sort of a retirement plan, whether their company's paying for it or if they're paying for it. So when they start taking distributions from those retirement plans, they're taxable. So it's not really $1, it might be $1.40 that they have to take out of their 401k to net $1.
That's right. So now going forward, if tax rates go up, how will that affect your average person?
It's just going to compound things. And remember, when we're talking taxes, we talk marginal tax rates. So a lot of times people get confused between an average tax rate, which is the tax you pay across your whole income, and marginal. When we're talking healthcare, we really talk about marginal, meaning you're paying at the highest rate that you happen to be in a bracket. So if 22% is your marginal bracket for somebody who's making $60,000 in retirement, then that's really what you're having to pay taxes on from a federal standpoint to take money out of your 401k to pay for your healthcare costs. In high tax states or cities like New York, where they have, not only do you have a state tax, but you have a city tax, this can really be devastating to a person's retirement plan, to the point that you might be looking at 50-60% of your dollars coming out being used to pay taxes. So that just compounds what you have to take out of your retirement plans to pay for healthcare costs. But the bottom line is there's a better way.
Yes, absolutely. You may have heard us talk about our healthcare money plan in some of our other videos. The healthcare money plan is essentially a combination of different solutions that are going to be a little bit different for everybody, that will allow you to pay for healthcare in retirement tax-free anywhere possible. if that makes sense.
It does. And Shannon, that's the one thing that we just focus on with our clients is how can we get tax-free dollars out for you so that when you get to retirement, you're not having to pay those higher taxes. You can use it to pay for health care. And you can also, as we say, protect against the what ifs, the things that might happen down the road, like long-term care or nursing home, or just having to have people come into your house to take care of you. So, and then in addition, we've talked in some of our other videos about where tax rates are today, but as things go up, and we pretty much think taxes are going to have to go up just because of the cost of entitlement programs, then we're going to see people with lower Social Security and maybe a cut to Medicare benefits. Who knows? So again, planning for all this is important.
Yeah, you mentioned Social Security. I mean, we have some clients who unfortunately didn't start working with us until it was a little bit too late to plan for some of these expenses, and they're seeing their entire Social Security check being eaten up by Medicare premiums alone because they are subject to that Medicare means testing and they've got this tax problem. So it's really important to plan properly, and that's what we're here to help you do, whether it's an HSA or using a life insurance policy. There are a number of different ways that we can structure a healthcare money plan that's right for you. So if you're interested in learning more about that, watch some of our other videos. You can subscribe to our channel, click the notification bell so you know when we come out with new videos. And then you can also check out our description below where you can apply to become our client. And if you're in the beginning planning stages, the number one thing that you need to do is get a good idea of what your healthcare costs will look like. There actually is a way that you can do that. We have a crystal ball, is what we like to call it, where we can essentially get a little bit of information from you and calculate what you're likely to spend on healthcare costs in retirement. That's the first step to planning. You can do that in a link that we've provided in our description below. I think you can see somebody's keeping our lawn in front of our office really nice and clean right now, so apologies for the lawnmower noise. But yeah, any questions, feel free to let us know in the comments. Remember, we're Shannon and Michael. We're with Healthcare Genius, and we're always here to help. Thanks.